Hi guys, it's Mr. Pharma. As of today, there are nearly 3 lakh people affected by COVID 19 in India, and nearly 75 lakh people are affected worldwide. This impact has resulted a worldwide demand for hand sanitizers. So, in this video, we shall see overview of hand sanitizers, its global market status, how to make a hand sanitizer in home, how to start your own hand sanitizer manufacturing company, and what are its requirements. So, welcome to Pharma Portal, the Pharma you need to know, share, and grow. The content we explain here may change and vary to existing rules and procedures time to time, so viewers' discretion is advised. So, what are hand sanitizers? It's a supplement that is used alternative to soap. Soap and sanitizers functions the same, but the convenience of sanitizer is it doesn't need water compared with soap. Sanitizers can be carried to different locations such as public transports like buses, train, etc. So there are two types of sanitizers. One is the alcohol based and another is alcohol free sanitizer. The most preferred hand sanitizer formulations are gel, liquid and foam formulations. Use sanitizers during any external visits, especially during hospitals, etc., or if soaps are unavailable, or if you cough or sneeze. Do not use the hand sanitizers if your hands are dirty and greasy, for example, after gardening. The global market has grown rapidly due to the pandemic, and by 2026, the market size will be $3.6 billion. COVID 19 infection rate, personal hygiene awareness, and global demand and supply will drive this market more than ever. So, the future will have a higher demand for hand sanitizers. The key ingredient in alcohol-based sanitizer is 60 to 99% alcohol like ethanol, isopropanol, etc. Whereas in the alcohol-free sanitizer, it is the antiseptic chlorhexidine, iodine, etc. Before you make a hand sanitizer at home, ensure the quality checks and click the link description given below and read the guide to local production information thoroughly. The quality checks include verifying the alcohol content using alcohometer, and post-production analysis is required if you are using ethanol or isopropanol. Ensure you do the preparation in the cold rooms or air-conditioned rooms. Strictly no flammable items should be allowed or present. Also read national safety guidelines and local legal requirements. Labeling of the final package should cover the whole labeling requirements. There are two 10-liter WHO proposed formulas. You can choose anyone or both. Keep the listed materials as shown in the formula. Add alcohol into a big bottle or tank, then add hydrogen peroxide to it. Slowly add glycerol into the tank and add distilled water to glycerol and rinse and ensure all the glycerol is poured to the tank as it's viscous and sticky. Add distilled water to make up the 10 liters. Immediately close the bottle tank with the lid cap to avoid evaporation. Gently mix the solution and pour into 500 ml and 100 ml bottles as per your needs and label as per WHO recommendations. Use the solution after 72 hours. Due to high demand for hand sanitizers, let's see what are the guidelines and requirements for starting and getting a hand sanitizer license for your company. Considering Uttar Pradesh having a lot of manufacturing hubs, let's see their requirements. The license process involves the following steps. Step 1, filling the application online. Step 2, paying 7,500 rupees fee to the Drug Licensing and Controlling Authority. Step 3, the drug inspector inspects the manufacturing unit. Step 4, headquarter reviews the DI report and issues the license. So now let's see the document requirements. You need Form 24, a fee challan of rupees 7,500, map of premises, NOC of pollution and fire department, water test report, list of machinery and equipments, proof of building ownership, rent agreement if applicable, constitution of the firm, affidavit of the responsible and authorized person, health fitness certificates of the workers, and consent of outside laboratory testing if applicable. So the building requirements are the area of the manufacturing unit should not be less than 600 square feet and should have a change room, a solution preparation room, a filling and packing room, a store room for raw material, packing material and finished goods, and quarantine area and laboratory for testing the raw materials and finished products. The machinery requirements are a solution preparation vessel with a suitable stirrer, storage tanks, filling and sealing machine, and finally the labeling machine. The technical person requirements are a manufacturing chemist, an analytical chemist, chemist who may be having a graduation in M.Pharm, B.Pharm or BSc with a suitable experience in manufacturing and analysis respectively. Finally, the manufacturer should comply with DMR Act. The rules and requirements may vary state to state, and having a consultant to obtain a license is preferable. Hope you liked this video. Encourage us by hitting the like button. If you have any question, post it in the comments and share this video to your friends and family. Most importantly, subscribe and press the bell icon for regular notifications from our Pharma portal channel. Bye.